I'm Dr. Delicia Haynes, for those of you who don't know me. And I'm the founder and CEO of Family First Health Center, which is direct primary care practice down here in Daytona Beach, Florida. I came to my first summit in 2014, was a bit overwhelmed, was too afraid to actually do anything. And I asked the universe or God for a sign that this is what I was supposed to do. You got to watch what you wish for, because months later, I got a letter from the largest insurance company with a 40% cut to how much they were going to pay me. I started my own practice straight out of residency, fee for service. So I got that letter, and then the local hospital pitched my, kind of plucked my biller. And that was when I decided that I was going to make this shift to direct primary care, even though at the time I was clinically depressed. So I just wanted to share that, because if this is the first time that you're looking at DPC, sometimes it can be a bit overwhelming. But you know, it's been such a great, I have no regrets for, you know, how for making the switch. My only regret was not doing it sooner. So with this, I'm going to go ahead and share my slides. Fantastic. So I'm going to be talking a bit about basically how to engage your community to grow your direct primary care. Because it's great that you're a fantastic doctor, but obviously if you don't have any patients, it's not going to work. And the really thing that I want to focus on is inviting people in to help you build your practice. So we as physicians, we have a tendency to think that we've got to have everything together and that it has to be perfect from the beginning. But really, that's not the truth. You know, when you think about how, if you were doing missionary style medicine, you know, what kind of things you take with you to go out in the field and practice medicine, it's very basic. And so we kind of we make things a little bit more complicated than they need to be. And a lot of that, that look of complication is one of the reasons that physicians are so afraid of starting their own practices, that they actually believe the, you know, hospital administrators who say you can't do this without us. But the truth is, if you can go through medical school, you can start your own practice, and obviously all the skills that you have learned are in your hands and they're in your mind, and they are yours to take with you wherever you want to go. So, you know, just want to caveat with that. The other thing I wanted to say, you know, so this is a little nod to the Field of Dreams, because that's where my title kind of originated from a little bit. I am going to be using some farming words, but I'm not a farmer. So I don't want anyone to feel like, you know, I misled you. I'm not one. And I also don't play baseball. But we're going to be talking about, you know, just some ways you can find and plant and cultivate, and then of course harvest, to build your unique direct primary care. And so the first thing is that you have to realize what you want. So in medicine, we always are putting the patient first, and not that that's not a great thing, but you have worked so hard to get to where you are right now. And if you're considering this shift, if you're considering going into direct primary care, this is a great time for you to really look at what was in your mind and your heart when you wrote your personal statement to go to medical school in the first place. And then, you know, is that what you're building if you were to, you know, start your direct primary care? So it's really important that you reverse engineer what you're trying to do. So, you know, do you want to spend time with your family? You know, do you want to be able to go on vacation? How much do you want to make? You know, all of those type of things are things that you need to be thinking about. And then also, what is it that you're passionate about? You know, there are certain things that, you know, it's just a natural fit for you, and you just wake up and because it's so innate, you don't even give credit to how awesome it is that you can do it. So really, you know, it's time first to kind of get into your own heart, and what is it that I really, really want? Because the last thing that you want to do is recreate the prison that you were leaving. So when I started my own practice straight out of residency in the fee-for-service model, I had, you know, my heart was in the right place, but I created my own prison unintentionally. And it's possible to do that in a different model if you're not really intentional about, you know, what you want and what you're trying to build. So really think about your passions and what it is that you truly, truly want. And then there also, just as important as that, is what does your community need? So you are going to be solving people's problems. You are a solution to a lot of people's problems. And there's kind of this, you know, there's the kind of this one axis of what you want, and then there's another axis of what your community needs. And definitely where those two cross, you know, that's like the sweet spot. So we want to make sure that we are doing what we want and doing what we are passionate about, and make sure that we're intersecting that with our community needs. One of the things that nobody was talking about in my community was depression, and with suicide. Now I won't say that I started off with my direct primary care journey talking about this issue or this platform, because the truth is I was clinically depressed while I was making my transition. And so, there's certain stories that you can't stand on top of and talk about, because every time you do, you sink in it because you're still going through it. And I know that Paul's going to be talking about, telling your story a little bit later on. So, but it is really important that you get comfortable with, what your story is, and making sure that's a story that you can kind of stand on top of. But I talk often about depression. Now, unfortunately, that happened after I lost my best friend, to suicide. And we lost a second-year medical student. But, I recognize there weren't prominent individuals in our community talking about the importance of mental health and how it's just as important as physical health. So I found that need was really just to inspire my community. And so that's one of the things that I was, looking forward to doing, and what I did. I ended up writing a book about it. Now, I couldn't write a book in my previous practice because I never had time to, and that's one of the beautiful things about direct primary care, is it really opened up, a time for me to go after all the other passions that I had that were kind of outside of, my regular day-to-day clinical medicine. And I know you've met some of the direct primary care doctors, the most passionate people on the planet, it feels like. But it's beautiful that when you recreate a model that really supports your lifestyle, you're able to, do other things. So that was one of the things in my community that nobody was talking about, was depression. But again, I didn't start off there because when I opened up and switched over to direct primary care, I was clinically depressed, so I couldn't talk about that story. So what I led with when I started with my other passion, which is physical health. So I was a college athlete, and I was really blessed to have both a full ride academic and athletic to go to the University of Louisville. And that broke down a lot of barriers for me. So I wanted to make sure that I could do that for other kids who, wanted to go to school and, was able to use their talents, be it academic, athletic, or both, to make that happen. So some of the things that we've been doing in the community since we started was free sports physicals. So, we partnered with other organizations in the community and was able to just kind of decrease that barrier for, kids being able to, participate in sports, decreasing obesity, and all of those things. So, that was one of my passions. Yours is going to look very different because, maybe you love cooking. I love eating, but that, the cooking thing and work in progress. So, you may have a whole different passion that you're kind of, helping and bringing to your community, and you want to make sure that you're doing that. And I, roped in all of my friends to help out with that. And that's another really important thing, is that making sure that you are allowing people to help you and volunteer for you. A lot of us are, and myself included, are not great at asking for help. So, making sure that you're kind of opening up your space of like, okay, this is my dream. This is what I want to do. And you'll be surprised how many people will rise up to help you do it. Just about all of my office furniture was donated when I started opening my mouth and telling people what I wanted to do. So again, really, looking at your passions and looking at what your community needs. Meet the people where they are. So it's so often that we make people come to us, that we sit in our clinics and we're just like, I wonder where the people are. And we're just waiting, but the people are out there. So if the people are out there, that's where you need to be. So, now if you're not the biggest extrovert, it's really important that you find something that you're really passionate about, that you can feel comfortable either kind of writing about or some kind of way conveying, but you want to find a way to meet people where they are. So this is just one of the many presentations at a church that I gave. The topic that one was on depression and mental health. But, you just want to make sure that you're going out and you're, meeting people where they are, and then you can invite them to kind of come back and, meet you where you are after you've come to their place. And for, all of us who are doing things like, home visits, it's amazing how much more you see when you're in someone's space. you see, the rug they're gonna trip over, and all of those things that when they come to your office, you don't see half of those things. So meet people definitely where they are. And then find innovative ways to be a solution. So really you want to make sure that you're listening to what's happening. So this is one of the initiatives that we did called the Cut High Blood Pressure Initiative, where we taught barbers and stylists how to check for blood pressure, and so that as their clients were waiting to get their hair cut, they could check their own blood pressure. Now, the way this came about is it wasn't my idea. Someone else did a TED Talk on this. My sorority sister saw the TED Talk and she sent it to me. And at first I was like, oh, well, I don't know. And then the very next day I had a gentleman come in who had a razor sharp edge and a blood pressure of 200/114. And, I looked at his hair and I knew where he was going every week to maintain that. And where he wasn't coming was to the doctor's office. So, that was kind of when, that light bulb went out that like, okay, again, meeting people where they are, going there and making sure people, know, because he was just walking around like that. So we went out and we, taught that, and it was, some of the barbers and stylists really took to it, and we're promoting it, and we're showing people other places it was probably collecting dust, but I went out and I bought a bunch of blood pressure cuffs, and I made some rack cards that had like what normal ranges are and a place for them to write theirs, and then on the back had our contact information, so if you don't have a doctor, we would love to be it. And it was really it was we got a good response from that. We in Daytona Beach, we don't have our own news station, so kind of getting news coverage is sometimes a challenge. But we did have like someone from over in Orlando who kind of came over and gave us a little shout out, and then also our local paper covered that as well. They've never just covered like direct primary care in general for some reason, but they do cover the things that we do in the community. So definitely find a need in your community and find a creative way for you to fill it. And then make sure that you're always expanding your network. So there are certain people that I would never cross paths with because I don't play golf with them or play golf at all. Or I'm just not in the same social circles as they are, but they know the people that I want to take care of. So this room is a room full of CEOs in our community. And I knew the person who was kind of leading the group, and I just asked them, like, is there any topics that you guys want to hear about? And they really wanted to hear about stress reduction. It's like, well, I can talk about that. So I came in, I talked about, stress reduction, gave them a lot of value, was invited to talk to their teams about stress reduction. And then they asked me if I was interested in joining their group, would I, even though at the time I did not, qualify to join the group, but I still, brought a lot of value. So expanding your connections, expanding your network. You've heard that term that your net worth is your network. So making sure that you're always, looking for ways that you can connect with people and, connect with the people that they know, because all of these people, they employ people that I love taking care of. And so that's one of the ways that we've been able to grow our practice is by, going that way. And I love taking care of small business owners and small businesses, because if you have the gumption to go out and start your own business, you're definitely my people. So definitely always expanding your network. And then making sure that you're building referrals. On one end, I'm a little bit of the height of hypocrisy in this, because I don't oftentimes ask my patients for things like Google reviews, which is really important. And there's systems out there to automate that, and that's it's key, especially early on. But making sure that you make it really easy for people to find you, to join you, to say great things about you. When you're in with your individual patients, make sure that you ask them, hey, do you know someone else who would love to get same or next day appointments, longer ones time with their doctor, and virtual visits? Because oftentimes people do, but if you're not like asking them, then it's just not top of mind. They get busy and they're kind of moving on to their next thing. And then also your team. So making sure that you're building your team so that they can also help with that. So all of my team are base plus commission, so they get a bonus basically for anyone that they're responsible for introducing to us. So there's a lot of things that you can do to kind of build your community, to build that referral network, and just make it easier to, to grow the clinic that you always wanted. And it's really important to be strategic about where you place yourself and who you're talking to. So it's important that you're kind of watering. So we want to make sure that we're cultivating. Once you plant a seed, some of those seeds do not take root and grow overnight. I'm just now seeing the fruit of seeds that I planted 2 and 3 years ago that I just was like, maybe they're just not into us. And sometimes they're not. So, that picture on the bottom where they're watering the street, there are certain times when you have to look at like where you're putting your efforts and is it where they need to be. There are certain people, it's kind of like dating, like sometimes they're just not that into you. So it's really important that it's okay to go for the low-hanging fruit. There are certain people who are looking for the type of healthcare that you are providing, and make sure that you're making it available to them, and make sure that you're continually nurturing, that list and being really strategic about it. So, you don't want to just kind of like water it once and then forget about it and it dies. And caveat, most of the plants that I take care of are deceased. But I've got like 3 that are growing. And so, want to make sure that you are taking care of your patients, that you're taking care of your networks, that you're kind of having a strategy behind that. And this is another place where technology can be a benefit. It's really good that you have a strategy behind what you're doing, and technology can really be amazing. So I've been using Hint for years, and it's really helped me to have that streamlined process. But there's technology that's out there that can really help you stay organized. If organization is not your best thing, it's important but not always like the highest thing. So make sure that you have some strategy behind that, and you're putting your efforts where they're going to be the most fruitful. And then also, you do have to close the deal. So, make sure that you're making that offer for them to join your practice, and make sure that you're making it very, very easy for people to join your practice and to pay you. So, people can just go to our website and sign up. And yes, that's how most DPCs are, where people can just, go and sign up. And then we try to get them in as quickly as possible, or, do a virtual visit as quickly as possible. But it's really making sure that you also kind of guide them into your bucket, your clinic, after you've spent, all that time kind of nurturing, that group, so that you can, obviously, have the practice that you want with the people that you really wanted to take care of. So you do have to make sure that you're making that offer when someone says, oh, this is amazing. And you're like, okay, well, let's get you signed up. You can either do like credit card, or we can put it through your bank, whatever one you want to do. Nice thing about, organizations like Hint is that if they decide to do their credit card, it'll kind of remind them like, you can use your bank and it has less fees, which is always nice for us. But I always recommend, allowing people to pay any kind of way that they want to. Don't put any barriers into people paying you. If there are fees associated with it, then you want to make sure that those fees are in your overhead, so that you're already accounting for them, so you don't even feel it. So that's, people want to be able to pay with their credit card, make sure that they're able to do that too. But it's nice when you have technology behind you that can support that. And then you might have to pivot. So 1 Million Cups is one of the places that I love to speak. And it's one of the places where I met one of our first largest businesses that we take care of. But obviously right now we're not doing a lot of large in-person meetings, hence Hint TV. So we had to make that pivot to doing more things online. And direct primary care doctors were naturally in a position to pivot so easily because we were already offering virtual visits. So it was really easy for us to kind of make that changeover. We've been able to do things with our patients. My partner, Dr. Kim, offered meditation classes via Zoom for our patients. So there's all things that you can do to pivot and continue to prosper. Not just prosper, but grow like crazy, actually, during a pandemic. And a lot of direct primary care doctors have been able to do just that. So you're still meeting people where they are, but where they are is probably going to be online. And everyone who has a group, they need someone to come in and bring really great medical information. So they need people to give them great information about COVID. They need them to give great information about high blood pressure and diabetes and all of those things that you manage every single day. And because we manage it all the time, we assume that everyone knows, but we know that's not true. So it's a great opportunity for you to join, someone else's group, or, be on their podcast, and, share your expertise as a way both to get that expertise out there, but also as a way to fill your practice. So there's some different ways that you can do that and make sure that you're in line with your goals and your vision and everything that you wanted to do. But pivoting is ultra important, and luckily it's really easy to do with direct primary care. I was really blessed with DPC that when my mom got sick, I was able to fly home to Kentucky and take care of her and be there for my parents and be there for my family as my mother was dying. And in a way that in my traditional practice, I would have still done it, but it would have been so much harder. Our practice continued to grow and flourish despite my personal life being a complete mess. So I love DPC for all of that. So Nora's coming on, which means that I'm almost over time. So if they build it, they will come out and they will grow it. And that is really the main thing I wanted to say. Again, I'm Dr. Delicia. You can follow me across social media, Dr. Delicia, MD. I did create a little thing that has some transition success secrets if you want that. And I guess now we'll open up for questions while I'm still on.
Did your passion influence where exactly in your community you ended up placing your practice, or was it more you kind of found a passion that matched up with the community?
Were they talking about the physical location of the clinic, maybe?
Yeah.
Okay. So I wasn't that strategic about the physical location. Let me tell you what I would have done, not what I did, because that's more helpful for you. So you really want to make it easy for people to find you. So if you can locate yourself, like there's a DPC guy who loves taking care of people who like work out in gyms, and his DPC is like in a gym. Like that's perfect. I am in a strip mall that is like nearly abandoned that you can't see from the main road. So it's not an ideal place. You can still grow in a non-ideal situation, but you can make it a lot easier for yourself if you're naturally in the crosshairs, kind of that natural cross-pollination with the people that you want to take care of.
And then what form of nurturing do you do with your seeds? Is it mostly in-person nurturing? Do you have email campaigns?
Yeah, so it is sometimes it is in the form of email campaigns that we'll send out, and we do some in-person. Sometimes it's not even a campaign. It's just like a single follow-up email to that individual if what we were talking about was very specific. One of the things most recently, I had read an article for that if dentists had their patients swish with a povidone iodine solution, that it killed coronavirus. And so we copied that and we sent it to all of our area dentists. And because there was a lot that didn't know about it. And so that was something that was very specific about, this is, maybe we can help you stay safe. And so we, grew with some dental practices, obviously, after we did that. So really, again, it's just about, you definitely don't want to like blanket people with information they don't want, because they'll just unsubscribe. But, if you find something that's very specific to a certain group of people, then definitely, find a way to share it with them.
Can you talk about how you use social media in your community, if you do?
Mm-hmm. So I use social media and just kind of doing, posts, and, I talk a lot about like mental health, because that's a passion of mine. So I'll actually come on and do like a live video and give like 3 tips on, X, Y, or Z. And then also just, putting things up like quotes that are inspirational. I kind of live in the inspirational space, one, because I need it, but also because my community needs it. And so, finding out what your passion is, and then, finding all different types of avenues that you can share it. So I've not used all the platforms. I'm not a TikToker. But, the major platforms, we definitely make sure we have a presence on.
And then what were some of the biggest challenges that you found when breaking away from the traditional model?
Really, the hardest was my own mindset, I think. And I share pretty liberally that I was depressed, clinically depressed when I was doing it. And sometimes we just need to take a break and take a vacation. And doctors are really good at working really hard. And I just kind of went straight into working hard again, even though I was really tapped out. So I think taking a step back and giving yourself time to breathe and really think about what is it that I want, not what's expected of me, what do other people want from me, you know, what's in this person or that person's best interest. It's really, you know, okay, what did I set out to do when I went to medical school with that dream, and how can I kind of bring it back if it's kind of on the edge of dying.
And then how do you track your marketing and community outreach efforts?
So really we look at how people find us. So, you know, all of our new patients, so there's an area like, you know, we use Hint, so there's an area there where they can kind of say how they heard about us. So we keep track of it in there. And then we also just ask people when they come in, you know, for their appointment, we'll just ask like, you know, how did you hear about us? And, you know, typically it's word of mouth, but I want to be more specific than that. Well, who told you? And so that you can, you know, one, we send like a little thank you postcard to people. Like we don't tell them like who signed up or anything, but we just, you know, kind of say thank you to anyone that, you know, sent us a referral, which is really cheap and really something that we forget about is like, just send a thank you card. Like, don't overdo it. But that's really how we keep track of it.
Did you make like a lot of flowers, wrap cards, pens, other kind of swag to kind of get your name out in the market?
I mean, we have wrap cards and we have pins, and we have, you know, those things, but really it's about yourself. So you are, you know, it sounds harsh to say that you're selling yourself, but that people want to know who the doctor is, you know, and then, you know, even if your clinic doesn't have your name, they want to know who you are and why you're doing what you're doing. So the way that I have always grown, every time I open my mouth, I grow. And now I'm not the biggest extrovert. So there was, you know, I had to really like amp myself up and get, you know, find things that I was passionate about and willing to kind of go on camera to talk about. But really every time I go out and I speak, every time I go out and I connect with people, we grow. So, and again, going out right now is not how we're doing it. We're doing it more really like this. So I'm on a lot of different Zoom meetings and chats and summits and just helping other people who are, you know, trying to reach out and take care of like kind of their group, and I'll come in and you know, share as well.